Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering eating disorders. So guys, without any further ado, let's just jump right into it. First question. Family dynamics are thought to be a major influence in the development of anorexia nervosa. Which statement regarding a client's home environment should a nurse associate with the development of anorexia nervosa? A, the home environment maintains loose personal boundaries. B, the home environment places an overemphasis on food. C, the home environment is overprotective and demands perfection. D, the home environment condones corporal punishment. And I'll give you a moment to think of your answer. If you're new to this channel, just press pause. Whenever you're ready, play and we'll resume. So the correct answer is C, the home environment is overprotective and demands perfection. So the patients that tend to have anorexia nervosa, they tend to be the high achievers. They tend to be the captain of the cheerleading team, the president of student council. They're the ones that the parents demand and expect perfection. So what happens is, everything around them, their whole life is planned for them, and they feel that they have no control. So the only thing that they can control is their body, what they put into their body. So with those type of patients, since they have no control over their lives because their parents are just so demanding, right? And so much is expected of them, they find their control where? In what they place in their mouth. So those patients with anorexia, they tend not to eat because that's the only place where they find control. They control their body. So even if they can't control anything else that's going on around them, they damn well sure can control their body. So C is the correct answer. A client's altered body image is evidenced by claims of being fat, even though the client's emaciated. Which is appropriate outcome criterion for this client's disorder? A, the client will consume adequate calories to sustain normal weight. B, the client will cease strenuous exercise programs. C, the client will perceive personal ideal body weight and shape as normal. Or D, the client will not express a preoccupation with food. And I'll give you a moment to think of your answer. Okay, guys, and the correct answer is C. The client will perceive personal ideal body weight and shape as normal. Because if you go back to the question, they tell you that the patient's diagnosis is altered body image, and they're asking you what would be an appropriate outcome. So if their body image is altered, they think they're fat. When they're emaciated, that means they're wasting away. A good outcome would be them seeing their normal ideal body weight as the ideal body weight as being normal. Okay, so it's C, that when they achieve the body weight that they should have, that they see it as normal and they don't see it as them being fat. Let's look at our other choices. We have A, the client will consume adequate calories to sustain normal body weight. Well, the problem in this question is how they perceive the weight. Okay, so them eating the normal amount of calories, has nothing to do with how they perceive the weight. Okay, so that's wrong. Then you have choice 2, the client will cease strenuous exercise programs. Well, they might stop the strenuous exercise program just to make you happy, right? But does that mean that they now have a healthy perception of a body weight? No, that's wrong. You have choice D, the client will not express a preoccupation with food. All that means is they're not outwardly verbalizing or they're not outwardly showing a preoccupation with food. That does not mean that they have a healthy perception of what the body weight should be and that it's normal. So the correct answer is C. When counseling a client diagnosed with bulimia nervosa, a client explains that the client's teeth will deteriorate because A, the emesis produced during purging is acidic and corrodes the tooth enamel. B, purging causes depletion of dietary calcium. C, food is rapidly ingested without proper mastication. Or D, poor dental and oral hygiene leads to dental caries. And I'll give you a moment to think of your answer. And the correct answer, guys, is A. The emesis produced during purging is acidic and corrodes the tooth enamel. So we talked already about anorexia. That's where the patient's not eating the adequate amount of nutrition to maintain a healthy body weight. That's anorexia. The patients who are anorexic tend to be malnourished. They tend to be severely underweight, right? Now, bulimia, the patients with bulimia, they normally tend to be normal average weight, or they might be a little bit overweight, not too much. The patients with bulimia, what happens is they get stressed out about whatever it is. They get anxious, and to compensate, because they don't have good ways to compensate with stress or anxiety. So what do? They overeat, because that's what makes them feel better, right? And then after they overeat, guilt sets in. I'm such a pig. Why did I do that? What's wrong with me? And then they go like this, and then they throw up. Okay, so the patient with anorexia is not eating at all. Patient with bulimia, they're eating, they're overeating, and then they purge. So what happens is the patient with bulimia, we tend to see their teeth erode because they're throwing up, right? All of the acid that should have stayed in their stomach, because it's the acid that's breaking the food down in the stomach, they're purging, they're throwing up, and the acid is coming up their throat and out of their mouth, and the acid is eating away at the tooth enamel. And guess what? Those patients tend to have sore throat because the acid eats away at the inner lining of the throat. You tend to see excoriation of the knuckles. Why? Because as they're leaning over the toilet to throw up, you start to see excoriation of the knuckles, okay? We start to see that patients have fluid and electrolyte imbalance because all the fluid and electrolytes that should have stayed in their body, they're vomiting, they're getting rid of it. So the correct answer, guys, is A, and I just explained why. A nurse should explain to a client diagnosed with an eating disorder that behavior modification programs are the treatment of choice because these programs, A, help the client correct distorted body image, B, help address the underlying client anger, C, manage the client's uncontrollable behaviors, or D, allows the client to maintain control. And I'll give you a second to think of your answer. And the correct answer is D, allows the client to maintain control. So the reason we love the behavior modification program is because that power is placed in the client's hand. You have to change. You have to change your behavior. You have to change the way that you think about food as relations to your body. Okay? So it gives them a sense of power. It actually empowers them because they're the ones who's making those changes and those decisions, and the decisions are not being made for them. Now, if you look at the question, it says that they have an eating disorder. Remember, guys, the eating disorder is all about what? Control. And so when you have a diet modification plan, you're putting that control in the patient's hands and not yours. Next question. A high school senior is diagnosed with anorexia nervosa and is hospitalized for severe malnutrition. Her treatment team is planning to use behavior modification. What rationale should a nurse identify as the reasoning behind this therapy choice? A, the therapy will increase the client's motivation to gain weight. B, the therapy will reward the client for perfectionist achievement. C, the therapy will provide the client with control over behavioral choices. Or D, the therapy will protect the client from parental overindulgence. And you guys all should get this answer correctly because I just gave it to you in the last question. And it's C, the therapy will provide the client with control over behavioral choices. We're handing the control over to the client. Next question. A potential Olympic figure skater collapses during practice and is hospitalized for severe malnutrition. Anorexia nervosa is diagnosed. Which client statement best reflects insight related to this disorder? A, skaters need to be thin to improve their daily performance. B, all the skaters on the team are following an approved 1,200 calorie diet. C, the exercise of skating reduces my appetite but improves my energy level. D, I'm angry at my mother. I can only get her approval when I win competitions. And the correct answer is D, the client who's angry with their mother. Why? Because they can only get approval when they win. That's a lot of pressure to put on somebody, right? So this person feels like they have no control over them. What's the only thing they control? What they put in their mouth. It's all about control. And so that's why that is the correct answer. Next question. The family of a client diagnosed with anorexia nervosa becomes defensive when the treatment team calls for a family meeting. Which is the appropriate nursing response? A, tell me why this family meeting is causing you to be defensive. All clients are required. All clients are required to participate in 2 family sessions. B, eating disorders have been correlated with familial patterns. Without addressing these, your child's condition will not improve. C, family dynamics are not linked to eating disorders. The meeting is to provide your child with family support. D, the client diagnosed with anorexia nervosa are part of the family system, and any alteration of family processes needs to be addressed. And the correct answer is B, eating disorders have been correlated with certain familial patterns. Without addressing these, your child's condition will not improve. What familiar patterns are we talking about? We're talking about the familial patterns of whether it's the mom, whether it's the dad, whether it's a big sister, whether it's a combination. But people in that family have too high of expectations. They're putting too much pressure on that patient. That patient feels that they have no control over their lives, so their only recourse is to control what goes into their mouths. So B is the correct answer. Now let's talk about the wrong answer choices. We have 1, tell me why. Stop. Look at me in my eyeball when I tell you this, because I got to make sure that you are hearing me loud and clear. We never, especially in psych, we never say, why did you? Tell me why, what made you? You never do that. The minute you say why, you're putting the patient on the defense. The minute you say what made you, you're opening a door for them to blame it on somebody else. Oh, I heard voices or whatever. You never say what made you. Tell me why. Why did you do this? You do not say that. So we got rid of that. That's wrong. Next choice. When you say that family dynamics are not linked to eating disorders, yes, they are. They're strongly linked to eating disorders. Choice D, clients diagnosed with anorexia are part of the family system. That's correct. But notice there's a comma. And any alteration in family processes needs to be addressed. That's wrong. Only the bad alterations need to be addressed. You notice, and they do this a lot with test questions, guys. They'll give you a right answer. They'll put a comma, and everything behind it's wrong. If the whole thing is not right, it's wrong. And even if you have to choose the second best, choose the second best. Okay? But if one portion of an answer choice is wrong, the whole thing is wrong. Throw it out. Next question. A client diagnosed with bulimia nervosa has been attending a mental health clinic for several months. Which factor should the nurse identify as an appropriate indicator of a positive client behavioral change? A, the client gained 2 pounds in a week. B, the client focused conversations on nutritious food. C, the client demonstrated healthy coping mechanisms that decreased anxiety. Or D, the client verbalized an understanding of the etiology of the disorder. And the correct answer is C, that the client demonstrate healthy coping mechanisms to decrease anxiety. Because remember what happens, those patients with bulimia, the only reason they start to overeat in the first place is their anxiety starts to go up. And in order for them to calm themselves down, they overeat, because overeating makes them feel better. And then after they overeat, they feel disgust with themselves because they had no control over themselves. And then what do? They purge into the toilet. Okay, so that's why C is the correct answer. We want them to have healthy coping mechanisms. If they start to feel anxious, talk about it. Write about it in your journal. We want them to develop healthy coping mechanisms so they don't revert to overeating. A morbidly obese client is prescribed an anorexia medication. About which medication should a nurse teach the client? A, diazepam. B, Redux. C, Meridia. Or D, Psych. And I'll give you a moment to think of your answer. And the correct answer, guys, is Meridia. That is an anorexia medication, so it helps to curb that patient's appetite, okay? So let's talk about our wrong answer choices. We have diazepam. That's actually an anxiolytic, and sometimes it's used as a sedative. We have actually the other way around. It's a sedative, and sometimes it's used as an anxiolytic. We have the Redex, that's an anorectic, and the way that works, it increases the serotonin in the patient's brain, and that increase of serotonin in the patient's brain decreases the urge that the patient will have to eat. And the last one, the Psych, that is a CNS stimulant, okay? Next question. A nurse is attempting to differentiate between the symptoms of anorexia nervosa and the symptoms of bulimia. Which statement should the nurse identify as correct? And I'm expecting you guys to all get this right since I already told you the difference. A, clients with anorexia nervosa experience extreme nutritional deficits, whereas clients diagnosed with bulimia nervosa do not. B, clients diagnosed with bulimia nervosa experience amenorrhea, whereas clients diagnosed with anorexia nervosa do not. C, clients diagnosed with bulimia nervosa experience hypotension, edema, and lanugo, whereas clients with anorexia do not. Or choice D, clients diagnosed with anorexia nervosa have eroded tooth enamel, whereas clients diagnosed with bulimia nervosa do not. This was pretty wordy, so I'll give you a moment to think of your answer. And the correct answer is A, clients with anorexia are going to have extreme nutritional deficits. Remember, they're not eating at all. Whereas clients with bulimia do not, because the clients with bulimia, they're eating, they just purge afterwards, but at least they're getting some nutrients, okay? Let's look at the wrong choices. You have B. It says the clients with bulimia nervosa experience amenorrhea. No, the clients with anorexia, they experience amenorrhea, and let me explain to you why. They become so emaciated that their menses stops. And I don't know if you guys have noticed this. That's why you'll see these extreme female athletes, the younger ones, such as like the gymnasts. Many of them don't have their menstrual cycle because they've lost so much weight. They're so emaciated. Their menses will stop. Okay. Choice C, client diagnosed with bulimia experiences hypotension, hypotension, edema, and lanugo. Well, let me tell you, it's clients with anorexia. It's clients with anorexia, they experience hypotension and lanugo, which is that fine hair on the skin. Well, yeah, on the skin. But it's a very, very fine hair. You know how your hair is supposed to be nice and thick and shiny? Well, the patients with anorexia, they're really not eating, so they're not having the nutrients to make their hair nice and thick and shiny. So the hair gets very, 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 very thin. That's a lanugo, okay? So we see that and hypotension in the patients who are anorexic, not so much edema. And then you have choice D, patients with anorexia have eroded tooth enamel. No, that's bulimia. Remember, bulimia, they're the ones who are doing this, and they're purging, okay? Client diagnosed with a history of anorexia nervosa comes to the outpatient clinic after being medically cleared. The client states, my parents watch me like a hawk and never let me out of their sight. Which nursing diagnosis would take priority at this time? A, altered nutrition, lessened body requirements. B, altered social interaction. C, impaired verbal communication. Or D, altered family processes. And the correct answer is altered family processes. We just talked to the family. We told them that they need to ease up because it's their controlling behavior that kind of led to the patient having this anorexia. And now here they are watching the poor kid like a hawk. This poor kid's going to feel like what? They don't have any control, and they're going to revert back to that behavior of what? Not eating, because they can't control anything else around them. They're going to control their body. Okay, so that's going to be a priority altered family processes. Okay, guys, I can't believe this. We're down to our last question, and this is to select all that applies. So please don't forget everything I've taught you about select all that applies. You're going to treat them as true or false to get to your correct answer, right? So let's get into it. A nurse should identify Topamax as a drug of choice for which conditions? Select all that applies. A, binge eating with the diagnosis of obesity. B, binging and purging with the diagnosis of bulimia nervosa. C, weight loss with the diagnosis of anorexia nervosa. D, amenorrhea with the diagnosis of anorexia nervosa. E, emaciation with the diagnosis of bulimia nervosa. And I'll give you a moment to think of your answer. Getting warm in here. Jeez. Okay, so the correct answer is A and B. Binge eating with a diagnosis of obesity and binging and purging with a diagnosis of bulimia nervosa. So let's talk about Topamax. What is it? It's an anticonvulsant. But the effect of it is that it decreases the frequency of having that urge to binge eat. Right? Decrease binge eating, patient loses weight. So that's why A and B are the correct ones, because it actually helps that patient lose weight by decreasing the frequency of binge eating. Guys, I hope you found this video to be helpful to you. I promise I'm going to be releasing more mental health, psych issues, practicing more questions and answers. I really appreciate your support, guys. I read every single one of your comments, and I try my best to reply to every single one of your comments. So thank you so much for your support. And I'm asking you to please help support this channel by liking and subscribing below, pressing that red bell, right? That's the notification button, so you'll be notified every single time a new video is released. And of course, please share my videos, guys. I'm really trying to get to my first 1,000 subscribers. Any classmates, friends, co-workers, anyone you know that's studying nursing, that's trying to study for their NCLEX, ATI, HESI, maybe they're studying for a midterm, a quiz, please share my video. Thank you so much for spending this time with me, and I'll see you on the next video.